Long-term care centers continue to be a hot spot for COVID infection. About 3/4 of those Utahns who have died have been older than 65, and many were patients at assisted living facilities.
News specialist Matt Rascone is live in Salt Lake County with more on the state's response and one man's struggle to find a safe place for his uncle. Matt?
That's right, guys. The guy we spoke to was trying to get his uncle to a care center before he tested positive for the virus. Of the 20 deaths the health department has announced this week, 16 were older than 65, 8 were residents at assisted living facilities.
Amid an upward trend in COVID-19 cases,
it's our choice.
The state's most vulnerable population is taking a hit.
Right now, it's really challenging.
Dr. Alan Nakashima oversees the state's response to cases at long-term care facilities.
Healthcare workers are part of the community, so they get infection and then they bring it into the facility.
A month ago, she says they were looking at 2 to 5 outbreaks a day. Today, that number has doubled, and they're struggling to keep up.
If you have a elderly loved one, it's always a challenge to figure out the best thing that you can do for them.
I would never have transferred my uncle knowing you had that many cases.
Darren Nord knows the challenge. His uncle had a stroke a few weeks ago and ended up at the Holiday Healthcare Center, one of many facilities he learned too late dealing with an outbreak.
I immediately said, we need to get him out of there now. And they said, we'll do what we can to help you.
Over the next couple of weeks, Nord says the number of cases there grew to several dozen. No other center would accept his uncle because of insurance and his potential exposure to the virus.
How in the world are we getting that many that quick?
This week, he got the bad news. His uncle tested positive.
I don't want to put them in danger, and I kind of feel responsible.
Nakashima says care facilities are doing their best to stop the spread, but the state lab is overloaded. Test results that used to come within 24 hours now take up to 6 days, and she expects things to get worse before they get better.
Undoubtedly, I think death rates go through the roof because they're about to do that.
Now, the care where Nord's uncle is living says they have implemented infection protocols, including setting up a COVID unit inside the facility. Right now, because of the COVID situation, they are not accepting any new residents. Guys?
Matt Rascone reporting live for us in Salt Lake County. Thank you.